Time to start. 안녕하십니까. 달라스 한인상공회의 신동원 이사입니다. 반갑습니다. 이렇게 저희 3회째를 맞는 K Brand EXPO를 찾아주신 모든 참가자 여러분들과 리테일러 분들께 감사 인사드립니다. Thank you so much all of the attendees and the retailers who joined this event. I would like to say thank you so much with us. Today we have a seminar with Miss Kim Scarborough from the Chemist Office of the Cosmetic and Colors. I want to say that FDA is his way, and she's going to say about the importing regulation. 자, 여러분들에게 오늘 이야기해 주실 분은 킴 스카브로 님으로서 현재 지금 FDA에 대한 내용을 오늘 얘기해 주실 것이고요. 가장 중요한 부분은 수입하는 물건들에 대한 규칙에 대해서 얘기를 하실 겁니다. 오늘 죄송합니다만 저희가 통역을 준비를 했었으나 오늘 진행되는 내용이 너무 예민한 부분이 많다 보아서 저희가 정확하게 통역을 해드리지는 못하고 저희가 오늘 진행하는 내용을 촬영을 해서 저희 상공의 웹사이트에 올려드릴 예정입니다. 물론 그곳에는 자막을 달아서 올려드릴 예정이오니 궁금하신 내용이 있으시면 웹사이트를 참고해 주시면 감사하겠습니다. 저희 웹사이트는 smart-bizexpo.com입니다. 자, 들어오셔서 봐주시면 좋을 것 같고요. 지금부터 시작하는 내용은 죄송합니다만 영어로 진행을 하고 Q&A 역시 영어로 진행을 하겠습니다. 감사합니다. Thank you so much, Miss Kim. We are ready to go. Would you mind that you can start it for us?
No problem. Thank you so much. Good afternoon.
You.
Good morning, everyone. My name is Kim Scarborough, and I am a chemist in the Office of Cosmetics and Colors at the U.S. Food and Drug Administration. So we'll go ahead and get started with our agenda for today. Next slide, please. So we are going to cover in this presentation the history of the FD&C Act, and I will definitely explain what that is and what that acronym is. We will talk about the definition of a cosmetic. We'll briefly cover cosmetics and color additive regulations. We'll talk about a cosmetics authority. We'll also talk about the definition of drugs and what we know here in the United States to be over-the-counter drugs. We'll talk a little bit about cosmetics registration. We'll also discuss labeling, compliance and enforcement, and the import process for cosmetics. I'll cover very briefly some FDA international activities that we're doing related to cosmetics, and then we'll have a quick recap summary and, of course, some Q&A. Next slide, please. Okay, so very briefly, I just want to explain what some of the history is that governs our agency and the products that we regulate, and then especially those products that are cosmetic products. So how did FDA actually get its start? Well, it started with the 1906 Food and Drug Act. At that time, it was known as the Pure Food and Drugs Act. And at that time, it did not cover or include cosmetics. What drove the inclusion of cosmetics into this federal act? Well, there was a product that was out on the market some time ago, and it was called Lash Lure. And what happened was there were more than 20 adverse events reported in the Journal of the American Medical Association. And this is what we talk about are adverse events. One person had at least one case of permanent blindness. There was even possibly one death. And those injuries subsequently led to the inclusion of cosmetics in consumer legislation, bringing us to what we have now, which is the FD&C Act, or the Federal Food, Drug, and Cosmetic Act of 1938. And then later on in 1966, the Federal Fair Packaging and Labeling Act, known as FIPLA, was also established. And that helps to provide labeling regulations for products that are retailed to consumers in the USA. This is important to know because it's important to know what the laws and the statutes are that cover these particular products, because they definitely impact imported products as well that are products that are made here in the United States. Next slide, please. So what is actually the definition of a cosmetic? For many of you all that are business owners, you may think you actually know or you believe you're retailing cosmetics, but you know what? You might actually have some products that cross over into a different category. So we're going to talk about what the different definitions is. Let's start with cosmetics. According to the FD&C Act, and I will refer to this act as FD&C Act going forward instead of saying the entire name, Section 201, articles intended for cleansing, beautifying, promoting attractiveness, or altering the appearance are considered to be cosmetics. Now, this does exclude soap in terms of that particular product category. Next slide, please. Now, what is a color additive? Now, you may be thinking it's basically a pigment, and it's a substance that imparts color to a food, drug, cosmetic, or medical device. Color additives are primary ingredients in cosmetics. A lot of people buy cosmetics primarily because of the shade or the color appearance. And they're important components of products such as lipsticks or eyeshadows. They may form after, and pigments also, or added color additives may actually form after reacting with the skin, such as the type of color additive that's used in a tanning product. And then also color additives may have other functions in a product, such as titanium dioxide or zinc oxide in a sunscreen, which we'll talk about what category that falls in just a second. Next slide, please. This is just a brief list. I won't go through all of it, but it is a list of the color additive regulations or laws that govern any color additive that you might want to put into a cosmetic product. It's really important to know that labeling requirements for color additives and products are elsewhere in what we call the CFR, that is the Code of Federal Regulations. And above, and you see in the bold, the 21 CFR parts, those are the other parts of the CFR that are related to cosmetics. It's really important to know that improper use of a color additive can make a product adulterated or misbranded. And we'll talk a little bit later on about what those definitions mean. Next slide, please. Now, what is the authority that the FDA has over cosmetics? You might be surprised. Really what it is that the law does not provide for FDA pre-market approval of cosmetics. So that means that the FDA does not approve formulas or finished good cosmetic products, nor do we approve cosmetic ingredients. That said, cosmetics should not be adulterated or misbranded, and a manufacturer bears the responsibility for the safety of marketed products. As I mentioned before, cosmetics should be properly labeled as cited in the FIPLA, which is the Fair Packaging and Labeling Act. And then, just so you also know, not only does the FDA not have to approve cosmetic formulas or ingredients, GMP practices related to the manufacturing of cosmetics are voluntary, not mandated. Product registration and establishments of cosmetic manufacturers, that's also voluntary. And then lastly, reporting adverse events to the FDA, that's voluntary. So we do have some limitations as it relates to the law, but we'll talk a little bit later on about where we do have authority and where we can enforce the laws that are in place. Next slide, please. Now, even though we do not approve cosmetic products or cosmetic ingredients, there are some things that are prohibited under the FD&C Act. So an adulterated cosmetic is any cosmetic that is harmful or injurious under labeled or customary conditions of use. So that could be the cosmetic formulation, it could be the container that the cosmetic is in, and it could mean, or it could be that a cosmetic product there's contamination. The manufacturer may be cited for insanitary conditions in terms of how a cosmetic product might have been produced. And lastly, if an unapproved color additive is used in a cosmetic, it is definitely considered to be adulterated. Now, on the other side of the fence, there may be a situation where we come across a misbranded cosmetic. And what that means is that cosmetic labeling is false or misleading. It could also mean that there's required information that's missing, or it's been presented improperly. The container may be deceptive, or it doesn't comply with the 1970 Poison Prevention Packaging Act, which is another law, and it focuses on child-resistant packaging. Next slide, please. Okay, so what is a drug? So we've already talked about cosmetics, but you'd be surprised. A lot of the products that you're probably familiar with by use or in terms of what you may be retailing may actually be a drug. And what is a drug? It's defined in the FD&C Act as any article intended for use in the diagnosis, cure, mitigation, treatment, or prevention of disease. And on the right is an example of what a drug label might look like. Now, where might you find this on a product that you think is a cosmetic? Well, possibly a dandruff shampoo. And you'll know what that is by looking at the top part of the label where it says active ingredient. If your product, even if it's a beauty product or what we call a personal care product, if it's got an active ingredient in it, then likely it's a drug. Next slide, please. So cosmetics versus over-the-counter drugs. We call them also OTC drugs. The general principle is if a product meets a definition of a drug, it must comply with the requirements for drugs, even if it also does meet the definition of a cosmetic. So to summarize, you could have a cosmetic product, you could have a drug product, or you could have a combination cosmetic drug product. Now, what are some examples of OTC drug cosmetics? And those are obviously products that are sold over the counter that you do not need a prescription for. Just a sampling of example here are antibacterial soap, anti-dandruff shampoo, antiperspirant, and sunscreens. Next slide, please. Now, as I've already said, cosmetic formulations and cosmetic ingredients are not they're not required to be submitted to the FDA for approval. And the same goes for cosmetic registration. Now, if we're talking about a drug product, that is absolutely mandatory that you must register a drug product. And you do that with a different part of FDA, our Center for Drug Evaluation and Research. But if we're talking about cosmetics, we have, and we strongly encourage manufacturers and distributors and packers to register their products with the voluntary cosmetic registration program at FDA. As the name implies, it is voluntary, and it is not an official list of cosmetic companies or products. But if you're a manufacturer, distributor, or packer, you can absolutely sign up to be a part of the program. Next slide, please. Now, we're going to get into a little bit of more of the nitty-gritty about the requirements for the labeling of cosmetic ingredients. Again, they're not required to be approved ahead of time, but you must comply with the laws that govern the labeling of said cosmetic ingredients. So mandatory ingredient declaration has been required since 1973. What is supposed to happen when you have a label on a cosmetic is that all of the ingredients must be individually listed in descending order out of prominence. Now, fragrance or flavor may be declared as such, and you don't have to go into what all are in that particular, fragrance or flavor without listing the ingredients in the fragrance or the flavor, because that can be considered what we call a trade secret. And then there are rules, as you see from the CFR notation here, for certain types of ingredient names. So the way that ingredient names are captured or written in the United States may be different in a different country or a different jurisdiction, but it's important to know that you must comply with the US laws for ingredient names and how they display. Now, and how do you figure that out? You can go to the International Cosmetic Ingredient Dictionary. We call it INCI. And the last one that was issued is the 16th edition. That was issued in 2016. And that is the basis of all the nomenclature for cosmetics ingredients. There's over 22,000 ingredients in that particular dictionary, which is owned by the Personal Care Products Commission. Additionally, in terms of mandatory labeling, there are required warning statements for certain types of cosmetic products. For example, cosmetics in self-pressurized containers, feminine deodorant sprays, foaming detergent bath products, and sun tanning preparations. And you see all of the CFR notations there. Those are the laws that you must comply with. Next slide, please. Compliance. So when we talk, now we're going to get into the compliance and enforcement of domestic products and firms. So this is where FDA can use its authority in terms of how we are performing surveillance on cosmetics in the marketplace. So again, we're very active as we monitor. We also accept and encourage information about complaints for competitors and from competitors or consumers. We also do and execute facility inspections. We also issue warning letters for firms that are not in compliance with all of the laws and the statutes that I just cited. And we also do perform seizures and injunctions. So the bottom line is this: even though we don't require formulation approval ahead of time, if we find out that you have not complied with the law, we can use our authority to take action against any violations. Next slide, please. Now, let's get a little bit into FDA import coverage. So just a little bit of data and information about imports. So cosmetic imports are over 2.75 million lines in fiscal year 2019. And it is 6.1% of overall FDA-related imports. So there's a lot of cosmetics that are coming into this country. And then, of course, because there's so much so many products coming in to the United States, but our resources are a bit limited. There are a few examinations and samples. And so less than 5,000 import samples are examined. And overall, we do about 3.1% of exams in terms of imports. Now, there are currently 10 cosmetic-specific import alerts, and they are located on the FDA cosmetic web pages. We'll have those for you at the end of this presentation. And there are broad categories for cosmetic-specific alerts, things that we're looking out for when we're looking, to try to flag any possible suspect products. Any products that contain unapproved color additives and that they aren't declared on the labeling. Poisonous or deleterious substances. If the labeling if it's missing language or any other mandatory information that I just reviewed, or if the cosmetics are, appear to have filth or they appear to have been made in insanitary conditions. And then there are also import alerts for cosmetic type products with drug claims. So again, it's really important that even though we don't approve labeling ahead of time also, don't just get out there and create labels with claims that you can't justify with data and back up, because we will flag products that may be making drug claims. Next slide, please. So the FDA import process, the product requirements are the same. The laws and regulations apply to both US made products and imported products. So again, it doesn't matter where the genesis or the origination of the product is. It matters that both domestic and international companies must follow the same laws if they want to retail cosmetic products here in this country. For domestic manufacturers, FDA does determine compliance via establishment inspections, and for imported products, FDA determines compliance with requirements at the time of entry at the border. Next slide, please. Now, FDA and CPB is Customs and Border Patrol. That is another U.S. federal government agency. We cooperate on import operations and enforcement. So all import entries go through U.S. Customs, and CPB does send FDA entries to FDA and flags any issues. FDA determines admissibility by assessing compliance with appropriate requirements, and we reserve the right to either release or refuse products if they do have the right information or if they don't have the right information. Now, if the FDA refuses admission of products that are trying to come into the country, CPB will enforce export and destruction of those products, and they also assess penalties and bond actions if this can't be accomplished. Next slide, please. Further talking about the import process, the FDA can decide to release goods if the paperwork lines up and if we can ensure that there are no adulterated or misbranding issues associated with the cosmetic products. We'll release the goods for to carry on and to go to retail for sale. But if there are any violations or any suspected violations, we absolutely reserve the right to detain the goods without exam. How can this happen? Based on two different things. It can be if there's a submission of required information, or if the incoming meets an existing import alert. And then how do we figure out whether or not there are violations there? So we typically go through a very thorough analysis. And what we do is we obtain more information through all different kinds of documents, or we may do an examination of the product, and we may do sample collection. So the bottom line is this: we are absolutely making sure that folks are in compliance, and we have tons of cases. We have a compliance management system, and we review those cases on a weekly basis. Next slide, please. Now, FDA field personnel are trained in the examination and sampling techniques, and samples are analyzed by FDA laboratories. Those analyses may uncover violations, which I just spoke of. Next slide, please. For the detention process, so let's say that, again, we can, from a visual inspection, we can detain based on the appearance of a violation. And the importer does have the right to give evidence to refute this appearance. So if we hold something or pause it, as long as you have your paperwork in place, this is known as the detention and hearing process. So we do have an entire process outlined, because our goal is not to keep your products in holding. We really do want you to be able to continue on with your business, but we have to ensure public safety. So this is why we go through this process. Now, based on the evidence, the detention will either stand, and it means we will stay with the refusal and we will refuse the product to be let into the country, or the findings can be overturned, which means we'll release the product to go forward and to go to retail sale. Next slide, please. Now, more about the refusal process. If a product cannot be brought into compliance, again, this is if we're holding a product and the manufacturer is trying to get the paperwork to us, and if there are still violations as we continue to analyze the case, the product will be refused entry. Refused product must be destroyed unless it's exported, meaning that the manufacturer takes it back. It is the importer's right to choose which path we're going to go, and you have 90 days to make that decision. Now, a redelivery notice will be issued upon refusal, and the importer incurs liquidated damages, meaning costs 3 times the declared value of the product if the products are not exported or destroyed. So that essentially means you can be fined if you do not do something with that particular product. And of course, FDA does have the authority to seize the product if certain criteria have been met. Next slide, please. So that's kind of the overview on the importing process, labeling, formulation, how do we categorize products, what's approved, what's not approved, or what requires a pre-approval versus what does not. I want to talk a little bit about how we are trying to make sure that we've got global presence in terms of cosmetics. And so the FDA and the International Cooperation on Cosmetic Regulation, known as the ICCR, is a voluntary international group of cosmetics regulatory authorities from Brazil, Canada, Chinese Taipei, the European Union, Japan, Republic of Korea, and the United States. We're all members, and we work together to promote regulatory alignment as much as possible. As I mentioned earlier in the presentation, all of our jurisdictions and countries are different as it relates to cosmetics and approvals and imports and exports. But we really try to make sure that we're working together so that the laws are clear to all of the cosmetics and manufacturers within the industry as they're conducting their business. Now, meetings are held annually, hosted on a rotating basis by steering committee members with quarterly teleconferences and more frequent work group meetings as needed. And there are various work groups that include, but aren't limited to, the Consumer Communications Work Group and the ICCR Website Modernization Work Group. I actually sat on these 2 work groups in this past calendar year, and you should be on the lookout because there will be some new, exciting consumer communications coming out about allergens in cosmetics. And that information will be from a global perspective. So I'm really excited to see that come forward, probably later in this calendar year. Next slide, please. So let's just recap in terms of what is FDA's authority. It is broad for many different types of products that we regulate. However, the authority that our agency has over cosmetics and color additives remains a topic of great interest to both consumers and industry. Here in the United States, generally speaking, there's a lot of push from Congress and legislators to make it so that it could be mandatory for that FDA make it that it's mandatory that people do submit their formulations and cosmetics and ingredients for approval to us. We're not there yet, but there is legislation in the pipeline to possibly make that happen one day. So definitely stay tuned. It's never a dull day with cosmetics. And labeling, compliance, and the import process related to cosmetics also remains a topic of significant interest to manufacturers, distributors, and entrepreneurs in the beauty industry, literally throughout the globe. Next slide, please. Now, we've covered a lot of information today. I'm sure you'll probably have questions after we are done with this presentation. FDA absolutely wants to hear from you. And so whether you're a small business, you're a consumer, maybe you're part of a trade association, you can send your inquiries to industry.cosmetics@fda.hhs.gov. Please be sure to send your questions and inquiries about anything related to cosmetics to this email, and someone will absolutely respond to your inquiry within 5 business days. Next slide, please. If you'd also like to keep up with FDA Cosmetics and what we're doing, please follow us on Twitter. Our handle is @FDA Cosmetics, and we tweet almost every day. So there's always new and interesting content on social media concerning our office and the laws and regulations that we follow. Next slide, please. Now, these next 2 slides are helpful links, all different kinds of web pages that are related to FDA Cosmetics, and those will be shared for you after this presentation. The first one is FDA Cosmetics homepage, FDA's authority over cosmetics, FDA's recall policy for cosmetics, FDA's inspection of cosmetics, labeling regulations for cosmetics, cosmetics compliance and enforcement. Next slide, please. FDA's key legal concepts for the cosmetics industry, FDA's resources for you, cosmetics manufacturers, packagers, and distributors, and then FDA's information for cosmetic importers. You should definitely check out all of these pages because a lot of them have answers to the questions that you likely have. But if you have questions after reviewing these web pages, again, feel free to email industry.cosmetics@fda.hhs.gov. So that is the end of this particular presentation. I'm happy to pause at this point to take any questions that may have come in.
Thank you, Ms. Kim. Okay, our advisory board, Ms. Leslie Carpenter, will lead us to the Q&A session. 지금부터 저희 자문단이신 레슬리 카펜터님께서 Q&A 시간을 진행하도록 하겠습니다.
Thank you, Daniel. Thank you, Kim. We could certainly see why you've just received a big promotion at the FDA. You're a terrific public servant. It shows. Thank you. Kim, we may get some Q&A in the chat, but we've received some pre-questions during the matchmaking sessions.
Okay.
And if you don't mind, I'd like to go through some of these questions with you.
Sure, that'd be great.
As technologies are advancing to aid with some of the skincare processes, what is the approval process for new technologies?
Thanks, Leslie. So when we say new technologies, the answer is it depends. So if it's a new ingredient, that, especially, and if it's a color additive, if it's a color additive and it's new that's wanting to be used in cosmetics, there is a color petition process that a manufacturer or a developer needs to go through. If it is, it could be like a new preservative system or another type of ingredient. It depends on the nature of that particular ingredient. I will say that one of the more popular ingredients that people are inquiring about is cannabidiol, or a CBD or THC type of vein. And so there's a lot of interest for that in the US. That is considered to be a drug ingredient. And as such, if you decide that you want to put it in a cosmetic product, you will need to follow the guidance that is on the other side of FDA, which is our Center for Drugs. We call it CDER. And so you would need to, depending on the nature of the ingredient, it's going to dictate which regulatory category it falls into. Does that help answer the question, Leslie?
That's excellent, because we actually had a couple companies that are incorporating CBD into some of the skincare products. So that's terrific. Another company asked the question, are stem cells that are added to skincare considered a drug or a cosmetic?
That's an excellent question. And we get that question quite often. And the answer is, and I don't mean to be ambivalent, but it means it depends. So it depends on the nature of the stem cell, where that stem cell was harvested. It could be a drug, but then it also could be a biologic. And so that is where someone would need to they would have to submit their full ingredient list, give more information about that, where that ingredient was sourced. And then we can make a more informed decision as to how to direct that inquirer and what the next steps are. Now, what we also recommend at the FDA is that manufacturers and companies and formulators, that they work with industry consultants so that they can be in compliance and stay up to date with the ever-changing laws. But it is always it never hurts to do an initial inquiry with us at FDA, but depending on the nature of the substance or the ingredient, it may be, you are likely going to have to provide a lot of information, and you may need to consult an industry consultant to assist you with making sure that you stay in compliance with our laws and regulations. Does that answer the question for you?
Absolutely. And then we have a number of companies that say that they are preventing dandruff. Say, for example, a shampoo that eczema, dandruff, and, even acne, soaps that say that they could cure acne or aid in the treatment of acne. Could you elaborate a little bit on, I know you mentioned some of those might actually be drugs. Can you elaborate a little bit on that?
Yeah, that is an excellent question. So the labeling side is it can be very complicated, and claims is a very intense kind of area. And so there are several different categories that claims can fall into, and depending on the nature of the claim, it may actually fall outside of the purview of FDA. Claims are actually, like marketing claims, are regulated by the Federal Trade Commission, which is a different agency. But we are more concerned with, what is the functionality? What is the claim that's being made? So again, for a dandruff shampoo, it's basically to mitigate what is the bacteria or issue causing the dandruff. That's considered to be a drug claim. That type of claim must be submitted to the other side of FDA, to CDER, to get approval. If it's a general cosmetic claim, meaning you're just going to cleanse the skin, or if it's just to be like general beautification, then likely it is a cosmetic claim, and we don't require those to come to us for pre-approval. Claims is a very interesting area. And again, we always say you can definitely submit a question to us. And all of our centers actually have an industry box. So we have industry.cosmetics, CDER has drugs. And so the questions can definitely come into us. But the best thing to do is to make sure that you are basically checking in with an industry consultant regarding whatever those claims are, so they can definitively tell you which category those claims belong to, and that will dictate which course of action you'll need to take, whether you'll be approaching cosmetics or you'll be submitting them for mandatory review to CEDAR, which is our drug component. Does that make sense?
Excellent. We're getting a lot of great questions from viewers at the moment. I'll address some of the English ones, and then I'm going to ask Daniel if he could help me with those in Korean. How long to get the approval from the FDA, and is there any way to reduce or expedite the fee to get it earlier to apply for 5110K?
Okay. So 5110K, I believe, is some sort of drug application. It might be a new drug application. I can't get to that webpage right this second, but as a reminder, cosmetics, there is no registration fee because registration is not mandatory. If it's a drug, then the process is completely different, and I'm not able to speak to what the timeline or the time frame is regarding any types of approvals on, from our drug division within FDA. So
Well,
does that help answer the question?
Excellent. Perhaps at our next K Beauty event, we will also include someone from the drug division, as it seems
Yes.
more and more of these cosmetics are leaning that way. Here's another question. What is the cost to get approved from FDA? Oh, we just answered that question.
That's okay. That's okay. I
No
know that
cost.
people are communicating in real time, and so
Yes.
that's no problem.
Yes. Daniel, would you mind addressing some of the questions that were answered in Korean, and I'll
Actually, the Korean question was they are asking to translate it and subtitle in the recorded file, putting on website. That's a lot of people are asking us to do that.
Yes.
So we will do it. Let me just explain to the attendees
Yes,
about
please.
one more time.
Please.
자, 오늘 통역을 해드리지 못한 부분에 대해서 정말 죄송합니다. 하지만 저희가 전문성이 부족해서 이 부분을 조금 더 강조하다 보니 영어로 하게 되었습니다. 저희가 이 부분을 자막으로 작성을 해서 최대한 빨리 올리도록 하겠습니다. 저희 웹사이트를 봐주시면 감사하겠습니다. Okay, we are explaining to them one more time. We will do the translation onto the subtitle. And
Thank you, Daniel. And Kim, if you don't mind, would you please share the contact information again? I know you've encouraged our South Korean manufacturers to, seek professional consultation when they can, but at least at a minimum, oh, there you are, at least at a minimum to get some of their initial questions out of the way, because if they don't need to be approved, if it's a simple question, it could save them money, and we all want to help our fellow business friends save money. So if you could share just the general contact information, that'd be terrific.
Absolutely. I'm sorry.
Kim, you're muted. I'm so sorry.
Can you hear me now?
Yes, perfect. Perfect.
So sorry, having a few technical difficulties. So the best way to get in contact with us being the Office of Cosmetics and Colors, is by email. And that email is industry.cosmetics@fda.hhs.gov. You can definitely send general cosmetics questions to that email, and someone will respond to you. And then also you can follow us on Twitter, and check in with on our web pages. A lot of we have over 150 web pages in the Office of Cosmetics and Colors. So a lot of the questions may be answered on those pages, and a lot of our main cosmetic pages, there's a drop down where you can get like an on-screen translation. But if not, you can definitely send the question to the inbox. And then we also do have translators in-house at FDA. So, we are trying to meet all of our stakeholders where they are. So please utilize the email if you have questions. Does that help, Leslie?
That's terrific. Actually, Kim, we just had another question come through that asked, very similar to that, is are there any translation services for those who write in, non-English speaking? And so that's, I guess that would answer that question. And do you ever have any satellite meetings in other countries? Is there anything that they should be aware of in South Korea that might be readily available to them?
So in terms of, let's go back to the translations really quickly. If because the people that manage the box and cosmetics, English is their primary language. If it does come in another language, that is going to delay the response, but likely we can, we'll do our very best to answer it in the best way that we can within a certain time frame. From a meetings perspective, and I'm trying to think, I don't know about any public meetings, so to speak. There are times when FDA in general does have public meetings, and those are on our main FDA web pages, and it'll have an announcement, public meeting, this is what's being discussed. But other than that, I would encourage folks to check out the web page that I mentioned, ICCR, where we have the cooperation on cosmetics with all of the different jurisdictions and countries. And there's information contained there, but the meetings that we generally host are usually internal and not public facing. Does that answer the question?
Perfect. And then finally, if we could just remind our listeners that, as you had said earlier, and I was so impressed with this because oftentimes people think of the government as an empty pit, but if you submit a question to that email address, it does get answered, which was really, really very encouraging.
That's exactly right. We're not bots at the FDA. There are live people that actually respond to that particular inbox. Again, we always encourage folks to start with our web pages first to try to, get the information there. And then, you can pivot to us to ask a general question. Again, I will say that our resources are a bit limited in the cosmetics part of FDA. And so we cannot, or we don't have the manpower, so to speak, to do full-blown consultations. Like there are times when people will send us an email and maybe it'll have 40 formulas, or, they basically want what I'm going to call the white glove service. And so FDA as a governmental entity, and cosmetics specifically, we don't provide that. And that is where we would encourage manufacturers or formulators to get with an industry consultant. And we do, one of the webpage links that I mentioned, it says resources for you. If you click on that link, you can maneuver there, pivot there, and get lots of different contacts and possibly maneuver to industry consultants that may be able to assist you in a more comprehensive way. Does that make sense?
That's perfect. Now, Kim, as you may know, our next speaker, we've been extremely privileged to have Dr. Graham Peasley, who is a professor at the University of Notre Dame. He's been published worldwide in a recent study he did about some of the harmful chemicals that he thinks need to be better regulated in this study. And so we've been privileged that he's agreed to speak to our group to let them know about what might be coming in terms of stricter regulations. I don't know if you have anything you could offer on that, but I thought I'd mention it.
That's great. I legally, there's not a lot I can say, but what I can say is that what I mentioned earlier is that we answer to Congress. And so it would be up to Congress if there were to be any changes in our authority. And so for those people who reside here in the United States, let your voice be heard. As a taxpayer, you certainly have the right to contact whoever your local representative or congressperson is. Generally speaking, again, FDA, we don't have a position on anything. We await to get direction. And when laws change, when Congress passes bills and laws, we follow that accordingly. So that's probably as much as I can say about the process, but at least I am out here encouraging folks and letting them know what their rights are regarding if they would like to see change. Does that help?
That's terrific. And what we're hoping is if some of these chemicals are actually harmful, our good manufacturers will take note of that and make some voluntary changes. So
Absolutely, absolutely. Because really, the onus is on the manufacturer and the formulator in terms of what ingredients they choose, how they choose to formulate certain products, what claims they associate with those products. So the onus is on the manufacturer and the companies. And so every manufacturer in the United States, every company, they've got a website on their product packaging. They have, an email. They're likely on social media. By all means, consumers have every right to reach out to the manufacturers and express how they feel. And they do the same with us. They reach out to us, to FDA, to say, we see these 11 prohibited and restricted ingredients, on the list. When will this change? And again, we have to go through the rulemaking process at FDA, but everything is governed by law. And so we, as a federal government agency, must follow the law of the land. And so that's how we operate.
Excellent. Well, with that, Daniel, I'd just again like to thank Kim on behalf of the Board of Directors at the Greater Korean Chamber of Commerce, and I'll turn it back over to Daniel.
Thank you so much, Ms. Kim, Ms. Leslie.
Yes.
It was honored to have you all. It's so good quality with the seminar in this chamber. Thank you so much. I hope our attendees and also our chamber members could connect you, get some more benefit out of you guys. Thank you so much. Have a great day, and I'll see you again.
Thank you, Daniel, for all of your help.
Thank you, ma'am. Thank you, Leslie. Keep in there, and we want to do another seminar with you, ma'am.
Thank you, Kim. Good luck in your new position.
Thank you so much, Leslie. I appreciate you all. Have a great rest of the day.
Thank you. Bye-bye. 자, 감사합니다. 지금까지 저희 3회째를 맞는 K 브랜드 엑스포를 참가해 주신 모든 어텐디 분들, 참가자들한테 감사를 드리고요. 방금 진행된 FDA 관련 세미나는 굉장히 중요한 부분이 많았습니다. 사실 저희가 부족한 부분이 많아서 동시 통역을 해드리지 못한 부분에 대해서 다시 한번 사과를 드립니다. 저희 웹사이트 smart-bizexpo.com에 들어오시면 저희 영상을 통해서 자막이 들어가 있는 번역본 영상을 보실 수 있을 것입니다. 다시 한번 감사드리고요. 잠시 후에 University of Notre Dame, 노틀담 대학교의 물리학 교수님께서 직접 나오셔서 북미의 불소화물이 들어가 있는 화장품에 대해서 세미나를 해주실 예정입니다. 많이들 참가해 주시면 감사하겠습니다. 감사합니다.